Thank you for tuning in to Watson Clinic Health Talk. Founded in 1960 as the philanthropic arm of Watson Clinic, the Watson Clinic Foundation has a long and proud history of promoting the wellness of our community through education, research, service, and collaboration. Even after nearly 7 decades, the Foundation continues to advance health and enrich lives thanks to the guidance of its distinguished leadership, which includes Chairman of the Board, Dr. William Roth, who is also the managing partner and a practicing dermatologist at Watson Clinic. Board members like Kay Annis Wilson, who is the daughter of one of the clinic's co-founders, Dr. Jerry Annis. And our guest on this episode, the Foundation's Executive Director, Kim Brunson. Kim and I will discuss all of this and more, including the Foundation's Circle of Care initiative, Arts in Medicine program, and medical scholarship funding. For more information on the Foundation's history, their board of directors, the various projects they're leading for the community, and how you can make a donation, visit watsonclinic.com/WCF. Thank you for being here, Kim. It's a pleasure to have you.
It's an honor to be here. Thanks, Jamie.
How long have you been serving as executive director of the foundation?
I started in November of 2024.
Well, in 2026, the foundation enters its 66th year of existence. And you think about how much has changed since then. Healthcare has changed. The population of this community has increased exponentially over that time, and so have their needs. So in kind of looking at the foundation's legacy and where you wanted to take it for the future, what was that process like?
It basically started out with Dr. Roth talking about how special Lakeland is, how special our community is. So Dr. Roth felt like we should pull together some strong community leaders in Lakeland to get their input. So what Dr. Roth had us do is start in the beginning. So we looked at how the foundation was created in 1960. We were able to contact 3 family members of the original founders. So Dr. Annis, his daughter, Kay Annis Wilson, she joined us. Laura Town Summers, Dudley Town's daughter, and Dudley Town was our first business manager, and he was our business manager for 33 years. It was more than 30 years. So Laura joined us, and Nancy Kibler Ross, and that was Dr. Kibler's niece. And so the 3 of them all provided input on how important the foundation was to their fathers, and in Nancy's case, her uncle, and touching the community, supporting the community, making sure we provided education and support through all kinds of different projects. And from this community advisory committee came the idea that we needed to do a strategic plan. So Kay Annis Wilson, Dr. Annis's daughter, she led us through that effort. And now we have a 5-year strategic plan. We know what our goals are, where we're headed, and with these amazing community leaders, and several of our partners are also on the board with the leadership. I think we're going to make our community just a little more special.
Yeah. So let's talk about some of the great things that the foundation has been doing lately, starting with the Circle of Care initiative. What exactly is this?
We received a $2 million donation from the Ann Edwards estate to focus on programs for our cancer patients. Transportation, lodging, if they need to stay in our area longer because of their treatment or surgery, food. There's all kinds of interesting or challenging needs that our cancer patients have. And we are blessed in our community to have a lot of resources. Well, now we're added to that list. It's kind of a beautiful thing. So one of the programs that we're in the process of developing that is a huge gap is concierge services. So how do they navigate and know who to call, when to call them, what's available? We recently met with Visti, and if you're 70 or older, you can qualify to be a client at Visti.
And that's volunteers in service to the elderly.
Correct.
Okay.
That is correct. And if you were getting radiation 5 days a week for 4 weeks, and you are over 70, it could be harder for you to drive to each one of those visits. And sometimes during the week, you start getting more tired. So you need somebody to drive you potentially. Well, you can schedule with Visti, and they can provide the transportation for all of those appointments, and which helps our patients actually come to those appointments. What we've found, the challenge is when they get tired, they don't have a driver or someone to help them. They just don't come. So instead of having 5 radiation treatments in a week, they might have had 2 or 3. So some of those navigating how to get a driver, how to get that help. Maybe it has to do with food, or maybe they even don't live in our area. They live 30 minutes away or an hour away. Now that drive for 5 days in a week becomes nearly impossible. But with the Circle of Care initiative, we're able to help those who qualify to stay overnight in a local hotel. And it's just so helpful. They're more secure. They can follow their treatment plan, and they have better outcomes. Our donor, Ann Edwards, that was her vision. She was a cancer patient, and she befriended another cancer patient who was unable to have enough transportation to make all of her appointments, and she learned that her outcome was not positive, and so that's why she wanted to make sure that we could create these programs and help as many people as possible.
Scholarships, medical education, nurses in training who want to continue their medical education. I mean, this has always been part of the foundation mission to support that, because it's really the future of healthcare in our community. And the foundation recently presented 4 such scholarships to worthy recipients, right?
That's correct. And we're actually fixing to share another scholarship with one more. But that whole program, we're going to put it on our website where people will apply. There will be a 30-day or 45-day period, and they'll apply. And then some of our board members will be responsible for reviewing those and selecting the folks that get those scholarships.
Let's talk about another major part of the foundation's efforts, and that's the Arts and Medicine program. Talk about a revitalization. This has been incredibly active, especially in the past year.
Tiffany Van Wieren is our Arts and Medicine program director, and she is absolutely amazing. We're the only ones that have an Arts and Medicine program, and we've put together, we are leading
We're the only one in this community or
Yes.
this area, right?
Yep,
Yeah.
we're the only ones. And Tiffany, her heart and her passion for arts and medicine, it's just so beautiful. And she touches so many lives, patients and our internal coworkers. There's a lot of programs she has been able to implement in the 3 years she's been here.
And one of those programs happened just recently with Arts and Health Week.
We had 20 partners. There are a number of organizations who are starting to work and add arts and health across the community. So there's lots of things that you can do. There's, some obvious things like yoga and Pilates that can be considered part of that. But when there's music that can be healing. There's all kinds of programming that's starting to pop up, and we're trying to get other healthcare organizations to participate, because we all have patients that can participate and actually benefit from this. But the Arts and Medicine program from Johns Hopkins, what Tiffany has helped us learn is if we're just doodling while we're waiting to go to a doctor's appointment, it lowers our blood pressure. There's so many things. So even at work, if we have a wall that we can color and we're just walking past that poster to color, it makes us more productive and calmer and, in some cases even kinder.
Yeah. We need that today.
We do.
So we've talked about arts and medicine and the continuing medical education scholarships and Circle of Care. Now, if you go to our website, watsonclinic.com/WCF, which stands for Watson Clinic Foundation, but we made it easy for you. All you got to type in is WCF. You'll find more information about all the initiatives and how you can donate to them. Now, if you want your donation to work towards a specific initiative, can you make that request?
Absolutely. So if you happen to be, you're passionate about education and you want to make sure it goes towards education or a specific scholarship, we can work with you and make that happen. If your passion is art, we can definitely earmark that for arts and medicine. And if it's for cancer patients. So right now, those are the three, the Circle of Care, arts and medicine, and the scholarship. So those are the three that we are focused on today.
Okay. You can read more about the history of the foundation, the present, the future of the foundation. You can donate. And even if you can't make a monetary donation, there's opportunities to donate your time and talents with a program like arts and medicine as well, because they're always looking for musician or artist volunteers to help the cause and to work with patients. It's just all such a great program, and there's a lot of good that you guys do for the community, and we invite everyone in the community to share in that mission.
Thank you, Jamie. Yes, I totally agree. This has definitely been an amazing journey, and we're looking forward to amazing things that we can continue to do. Thank you.
Thank you.